Okay, so today I'm going to do a little video about the cardio disorders of chapter 15 and 16 of our pathophysiology book. So, first there's some important vocab that you probably need to know for this chapter. It's split into two columns. The column on the left is chapter 15 and the column on the left is chapter 16, but we'll just go over them all at one time. So arterio versus atherosclerosis. Arterio is actual hardening of the vessels, whereas atherosclerosis is plaque buildup in the vessels. And then the next one is CCB, calcium channel blocker. This is a treatment that is used to prevent vasoconstriction. Nitric oxide, which is NO, that's how the book abbreviates it. That is for vasodilation, and kind of a weird way that I remember it is carbon monoxide. If you were to breathe it in and have carbon monoxide poisoning, it would make you sleepy, which would relax you, and nitric oxide is a vasodilation, so it's going to relax the vessels. Next is endothelin. That's vasoconstriction. I don't have a fun name to remember that, unfortunately. VEGF is vessel endothelial growth factor, which is just what it sounds like. It is going to promote new vessel growth in specific areas where they're needed. And then von Willebrand factor, which is going to come back to us from our clotting chapter, that's going to activate your clotting. And that's important for atherosclerosis because that is definitely a factor that can cause some plaque buildup. For our chapter 16 vocab, angina pectoris, it's just chest pain. Ischemia is tissue is deprived of oxygen, and these are both linked together because lots of the time ischemia can cause chest pain because those muscles are screaming for oxygen. They are deprived of oxygen. So those two are an important thing to link together in your head. STEMI, it's a type of myocardial infarction, and that is going to have to deal with the ST segment, and then NSTEMI is non-ST segment elevation. Yeah, there we go. And so that's just going to describe what part of an angiogram is affected when you're reading that. Thrombosis, it's just a blood clot. And then coronary thrombosis is a blood clot in coronary veins caused by, or it can cause ischemia and eventually necrosis. So those are some important vocab words that the book goes over. And these next slides are just going to be the different disorders that the book covers. I didn't do all of them. I kind of did the main ones that the book really has lots of paragraphs on. So definitely go back and look at your Making Connections chapters to get all of the disorders that the book goes over. But here we go. Okay, so I guess we are not going to do disorders first. We're going to go about how plaque forms. So this is really important for atherosclerosis. So first you're going to have some endothelial injury to your tube. So endothelium is just the lining of a tube, any surface really. So you're going to have an injury to that site. LDL is going to be deposited there. And the book especially said white blood cells. They're going to form, what if you can see my mouse here, these foam cells, and that's really going to block off part of that vessel. And eventually that is going to harden. And then your vessel obviously moves back and forth, and that hardening causes the vessel to not be able to move back and forth. And eventually all of this stuff down here is going to calcify, and your vessel is not going to be able to move and constrict and dilate as it should. Because of that hardening that's right there. And then eventually all of that can, or not all of it, but some of it can break off, and it can cause injury to your blood vessel and other places. So next, first two are hyperlipidemia and hypertension. So hyperlipidemia is elevated total cholesterol. It's your LDL, so your bad cholesterol. And it is just a factor for an increased risk of atherosclerosis, And then hypertension, elevated BP. That's something that's super common nowadays, and it's kind of a major problem in our society that lots of people have it, lots of people are struggling with it. So that's kind of a big deal nowadays. So high pressure puts The high pressure puts pressure on on the vessels of your cerebral arteries, and this can cause a stroke because that can cause an aneurysm, and then that can bleed and you will die, obviously. And then hypertension can also cause left ventricular hypertrophy. So you can kind of see in this picture here that your left ventricle is a lot thicker than maybe what it should be. And basically, your left ventricle has to work so much harder to pump that blood into the veins because the pressure is so high, because they're constricted or, whatever your issue may be. And so that left ventricle is going to increase in size, and therefore it's going to need more. It's going to need more coronary oxygenation? That's not the word I'm looking for. It's going to need more blood so that it can have the oxygen that it needs. We'll figure out what that word is here in a little bit. And then PAD, peripheral arterial disease. So it's just arteriosclerosis in the peripheral vessel. Notice that it says arteriosclerosis and not atherosclerosis. So we're actually having hardening of the blood vessels. And this is seen a lot in people's lower legs and their calves and their feet. And a major risk factor is being diabetic. So definitely keep that in mind when you're thinking in a clinical experience. One part to this is intermittent claudication. So that is just a leg cramp that is gone after rest. And it's basically those tissues are experiencing ischemia. They are not getting enough oxygen because the arteries cannot supply the oxygen because they're so hardened. And then an aneurysm is our next one. So an aneurysm is just a weakening of the arterial wall, which creates a little bubble. You can kind of see that here in the cerebral and abdominal. Sorry, my thing is kind of covering it here, but it creates turbulent blood flow. So normally your blood kind of flows in a straight line, but since there's a dip, that blood can't flow straight anymore. So it's going to have to, kind of bounce around in your blood vessels. And that can cause a lot of damage to your blood vessels because those blood cells are bouncing off the endothelium and damaging it. And I put here I didn't put a lot of symptoms in here, but there's very few, if any, symptoms until it ruptures. So, if you have an abdominal aortic aneurysm, sometimes they're palpable and you can kind of feel the pulse. And the book does kind of touch on the fact that if they have that, don't palpate it deeply until you figure out what that pulsation is. Because if you palpate that and it does rupture, that can kill that person. So let's not do that. Aortic dissection. So this one's actually kind of interesting because there's no known cause for it. And it's not random, obviously. There are definitely risk factors, but it can kind of happen at any time, just like an aneurysm. You can know you may not know you have it, and it bursts and you die. It's kind of just that crazy thing that can happen. So I like this picture here. So this is your aorta coming across here, and there are two walls to your aorta, and they split off, and then blood comes in there, and it'll fill that gap with blood. And the book, I guess, didn't really talk about what you could do to fix it, and I didn't really highlight it. So that's an interesting one. And then I think this is our last one. Nope, not the last one. Okay, angina pectoris, just chest pain. Don't think of it as anything more than chest pain. Don't let the big words scare you. It's just chest pain. So there's some different types of the book highlights. Unstable angina pectoris is chest pain that the patient has never experienced before. So they've never had it before. They are super worried about it, and it is not relieved by rest. That is kind of the bigger thing. Chronic stable, I forgot that word in there, sorry. Chronic stable angina pectoris is pain that the patient has experienced. They have been diagnosed and they are currently being treated for it. So if they have chest pain not all the time, but if they have episodes of chest pain, they have a diagnosis of whatever it is and they're being treated, that is chronic stable angina pectoris. And then Prince-Metal's angina is a vasospasm of a coronary artery, so a sudden involuntary tightening in some of your coronary arteries. And then microvascular angina is just a small vessel disorder that causes chest pain. So nothing too crazy in there. I'm going to see if I can move my Oh, I can. Awesome. Okay. Then MI, myocardial infarction. So myocardial ischemia, which is tissue oxygen deprivation, leads to the death of tissue because it's not getting any oxygen. And if you can kind of see this black spot right here, and maybe I picked the wrong picture from our book, but this is dying tissue. It's going to turn black, necrosis, not good. It is linked to the heart's availability of collateral circulation. So it's the extra blood that you have available to supply that tissue. And there are 3 important factors that the book did list that influence the amount of damage that your heart could sustain during an MI. So location, level of occlusion in the coronary artery. So let's say you're in this part of your heart, the left ventricle, and that part needs a lot of blood flow. So there's probably lots of other vessels going to that portion of your heart. And so a myocardial ischemia wouldn't be great, but you also have more vessels going to that spot. So that's a factor. And then the length of time the artery was occluded. So did you have chest pain and you waited 2 weeks before you went to the doctor? And now you're like, well, that probably wouldn't happen. You probably wouldn't make it that far, unfortunately. And then again, available collateral circulation. So whatever the other blood supply that your heart has available to get blood to that portion of your body, of your heart, I guess. Maybe the last slide? No, I think I have one more after this. Okay, ineffective endocarditis. This is an interesting one. The book kind of touched on it. There wasn't a whole ton of simplified information on it, so hopefully this kind of helps you to not have the huge words. So there's going to be an infection in the cardiac endothelium. So just like right here, the endothelium here, there's just an infection in there. And there's going to be inflammation because it's an itis, endocarditis. So endothelium of the cardiac muscle, itis, it's inflamed. There's an infection, right? Platelets form, they form a thrombus, they form a blood clot, and it's bad. Myocarditis, so that is just inflammation of the muscle wall of the heart. I thought the book had a good picture, and then I was looking for it and I couldn't find it, but that wall of the, there we go. The wall of the muscle is going to be inflamed. Again, it's an itis, inflammation. You can always assume when you see itis that it's going to be inflammation. Okay, this is my last one here. Let me see if I can move this over. Okay, pericarditis. Inflammation of the serous membrane that surrounds the heart. So there are 2 membranes that surround the, well, there's one membrane. It has 2 or 3 layers. And the serous membrane around the outside, that can fill with fluid, and that is called a pericardial effusion. So just like a pleural effusion where too much fluid is around your lungs, pericardial effusion is water in the pericardial sac of the heart, right? And then I put cardiac, I'm going to butcher this word, tamponade, I think is how you say it. And that is where over 200 milliliters of fluid is in your heart. So a pericardial effusion is just fluid around your heart. It becomes another special bad thing when you get a whole ton of fluid around your heart. And that is all I have for chapter 15 and 16. Stay tuned for chapter 17, 18, and 19 because I have 3 more to go. So it's going to be great. Thank you.